The Vascular Anomalies Center in Arkansas Children's is a center dedicated to the treatment, diagnosis of vascular lesions that occur in children. Some of them are on the surface, some of them are deep and are discovered by imaging, but they're essentially malformed vessels that have a propensity to grow on their own. What people need to understand about vascular malformations is that they're not cosmetic lesions. What they do is they continue to grow with time. So as a child ages, these lesions are also growing with them, but then there's basically a turning point where the malformation starts to get bigger on its own, and it advances and expands and starts to infiltrate deeper into the normal soft tissues and cause functional problems. So the goal behind managing vascular anomalies really is to kind of capture them at a young age so that they don't grow and destroy normal tissue in the process. Our Vascular Anomalies Center really is centered around the multidisciplinary team. We have at least 30 providers/researchers that are invested in the management of children with vascular lesions. Vascular anomalies will have sometimes clotting disorders associated with it. Vascular anomalies will sometimes be managed with chemotherapy. We have to have each of the different fields to be able to treat that. We're at the cutting edge, honestly, of managing vascular anomalies. We've been internationally known for the past probably 20, 25 years as being a leader in vascular anomalies management and being some of the true pioneers of the first types of treatment in these lesions. There's not a diagnosis in vascular anomalies that we don't treat. What we find that we're seeing are the ones that are the most complex vascular lesions, those at which they've gone to several different institutions and they found us and said, we'd like to be here. One of the unique things about our program is that we have a cadre of lasers that allow us to treat the cutaneous and aerodigestive vascular anomalies. So most institutions don't have either the lasers or the expertise to be able to manage these lesions this way. We developed the Arkansas Vascular Biology program. We are now genetically profiling the vascular anomalies so we can target the genes with pharmacotherapy to manage them. We are part of clinical trials of new medical therapy for some of the most complex and challenging vascular anomalies that is seen in our field. A reason why a family or patient would want to come to Arkansas Children's over other institutions across the country is because of the people and the personalized care that they'll receive right off the bat. From a phone call with a specialty nurse to make sure that things get organized correctly. I think what we do uniquely is make people feel like they're stepping into a home that is ready to take care of them and manage their condition on a personal level and not just as a diagnosis.